Welcome to my channel. In this video, we are going to learn about inguinal canal. We are going to see about its introduction, inguinal rings, boundaries, contents. We'll see in detail about spermatic cord, mechanisms of inguinal canal. Inguinal canal. It is oblique, musculo-aponeurotic tunnel in the lower part of anterior abdominal wall. It is oblique, musculo-aponeurotic tunnel present in the lower part of anterior abdominal wall. It is situated above the medial half of inguinal ligament. This is inguinal ligament which extends from anterior superior iliac spine to pubic tubercle. Inguinal canal is situated just above medial half of inguinal ligament. Its length is about 4 centimeters. Its direction is downwards, forwards and medially. Downwards, forwards and medially. Extent. It extends from deep inguinal ring to superficial inguinal ring. It extends from deep inguinal ring to superficial inguinal ring. Now let's say about inguinal rings. There are two inguinal rings, deep inguinal ring, superficial inguinal ring. Deep inguinal ring. It is an oval opening in fascia transversalis. It is an oval opening in fascia transversalis. There are 8 layers in anterior abdominal wall from superficial to deep skin, superficial fascia, external oblique, internal oblique muscle, transversus abdominis, fascia transversalis, extraperitoneal fat, parietal layer of peritoneum. Deep inguinal ring is present in fascia transversalis. It is situated 1.2 centimeters above mid-inguinal point. It is situated 1.25 centimeters above mid-inguinal point. Mid-inguinal point is the midpoint of the line joining the anterior superior iliac spine and pubic symphysis. If we draw a line joining the anterior superior iliac spine and pubic symphysis, midpoint of that line represents mid-inguinal point. Deep inguinal ring is situated 1.25 centimeters above the mid-inguinal point. It lies immediately lateral to inferior epigastric artery. This is inferior epigastric artery, lateral side. Deep inguinal ring lies immediately lateral to inferior epigastric artery. Superficial inguinal ring. It is a triangular gap in external oblique aponeurosis. It is a gap present in external oblique aponeurosis. It is 2.5 centimeters long and 1.2 centimeters broad at base. 2.5 centimeters long and 1.2 centimeters broad at the base. It lies above and lateral to pubic crest. It lies above and lateral to pubic crest. The sides of inguinal ring are called crura. They meet laterally to form an apex. Boundaries. Anterior wall. In its whole extent, it is formed by skin, superficial fascia, external oblique aponeurosis. In its lateral one-third, it is formed by internal oblique muscle fibers. This is deep inguinal ring, superficial inguinal ring. In between the deep inguinal ring and superficial inguinal ring, inguinal canal is present. So from here to till here, it is inguinal canal. Anterior wall of inguinal canal is formed by external oblique aponeurosis whole extent. We know that in front of external oblique we have superficial fascia and in front of superficial fascia skin is present. In the lateral one third it is also formed by internal oblique muscle fibers. Internal oblique muscle fibers. You can see here from here to here it is inguinal canal. Anterior wall of inguinal canal is formed by external oblique aponeurosis. In front of it we have superficial fascia skin and in its lateral one third internal oblique muscle fibers are present. Posterior wall, it is formed by fascia transversalis along its whole extent, conjoint tendon along medial two-third. In its medialmost part, it is formed by reflected part of inguinal ligament. Whole extent fascia transversalis. In the medial two-third, Conjoint tendon. In its medial most part, reflected part of inguinal ligament. Along its whole extent, fascia transversalis. In medial two-third, conjoint tendon. In medial most part, reflected part of inguinal ligament. Roof is formed by lower arched fibers of internal oblique and transversus abdominis, which is present inside the inguinal canal. Roof of inguinal canal is formed by lower arched fibers of internal oblique and transversus abdominis muscle. Floor. It is formed by grooved upper surface of inguinal ligament along its whole extent and abdominal surface of lacunar ligament in its medial end. Anterior wall is formed by superficial fascia, external oblique aponeurosis along its whole extent, and in the lateral one third. In the lateral one third, it is formed by internal oblique fibers. Posterior wall along its whole extent, it is formed by fascia transversalis. In its medial two third, it is formed by conjoint tendon. In its medial most part, it is formed by reflected part of inguinal ligament. Roof is formed by lower arched fibers of internal oblique and transversus abdominis. Floor is formed by grooved upper surface of inguinal ligament and abdominal surface of lacunar ligament in its medial end. Contents. In males, it consists of spermatic cord and ilioinguinal nerve. Spermatic cord and ilioinguinal nerve. In females, it consists of round ligament of uterus and ilioinguinal nerve. In both males and females, ilioinguinal nerve. In males, spermatic cord. In females, round ligament of uterus. Let us now learn in detail about spermatic cord. Collection of structures that pass from abdomen to testis together constitute spermatic cord. It is collection of structures that pass from abdomen to testis. It extends from deep inguinal ring to testis. It is 16 mm thick. Coverings from outside to inside, external spermatic fascia, cremasteric fascia, internal spermatic fascia. Just remember that there are three flat muscles from in front to behind: external oblique, internal oblique, transversus abdominis. And behind the transversus abdominis, fascia transversalis is present. Aponeurosis of external oblique. Muscle fibers of internal oblique. Do not consider transversus abdominis. Next we have fascia transversalis. External spermatic fascia is derived from external oblique aponeurosis. Cremasteric fascia. Cremasteric fascia is derived from internal oblique muscle. Cremasteric fascia from internal oblique. Internal spermatic fascia. Internal spermatic fascia is derived from fascia transversalis. Contents of spermatic cord. Ductus deferens. Next remember arteries, veins, nerves, lymphatics. Three arteries: testicular artery, cremasteric artery, artery to ductus deferens. Testicular artery, cremasteric artery, artery to ductus deferens. Veins, pampiniform plexus. Pampiniform plexus. Three nerves: genital branch of genitofemoral nerve, cremasteric nerve, sympathetic nerves. Genital branch of genitofemoral nerve, cremasteric nerve, cremasteric nerve, sympathetic nerves. You can see these are sympathetic nerves. Lymphatics from testis. Remains of processus vaginalis. Remains of processus vaginalis. Now let's see mechanism of inguinal canal. Inguinal canal is a site of potential weakness in the lower part of anterior abdominal wall. In the lower part of anterior abdominal wall, inguinal canal is site of potential weakness. This weakness is compensated by following factors. There are 5 mechanisms: flap wall mechanism, guarding of inguinal rings, shutter mechanism, slit valve mechanism, ball valve mechanism. Flap wall mechanism. Factor responsible is obliquity of inguinal canal. When intra-abdominal pressure rises, Anterior and posterior walls of the canal are approximated like a flap. Factor responsible is obliquity of inguinal canal. When intra-abdominal pressure rises, anterior and posterior walls are approximated like a flap. Guarding of inguinal rings. Superficial inguinal ring. Posteriorly, it is guarded by conjoint tendon and reflected part of inguinal ligament. Deep inguinal ring. It is anteriorly guarded by internal oblique muscle. We know that conjoint tendon and reflected part of inguinal ligament forms the posterior boundary. So remember, posteriorly, superficial inguinal ring is guarded by conjoint tendon and reflected part of inguinal ligament. We know that lateral one-third anterior wall is formed by internal oblique muscle fibers. Remember, deep inguinal ring anteriorly is guarded by internal oblique muscle. Shutter mechanism. Factor responsible is triple relation of internal oblique. Internal oblique forms anterior wall, roof, and posterior wall of inguinal canal. Inguinal canal, anterior wall in its lateral one-third, it is formed by internal oblique fibers. Posterior wall, it is formed medial two-third by conjoint tendon. Conjoint tendon is formed by the fibers of internal oblique muscle. Roof is formed by lower arched fibers of internal oblique. So internal oblique forms anterior wall, roof, posterior wall. When internal oblique contracts, it pulls roof close to the floor. It pulls the roof towards the floor. Slit valve mechanism. Factor responsible is contraction of external oblique. Contraction of external oblique approximates 2 crura of superficial inguinal ring. Slit valve, superficial inguinal ring. Superficial inguinal ring is formed by external oblique aponeurosis. When the external oblique contracts, it approximates 2 crura of superficial inguinal ring. Sides of superficial inguinal ring are called crura. This crura gets approximated when the external oblique contracts. Ball valve mechanism. Factor responsible: contraction of cremaster muscle. Contraction of cremaster muscle pulls the testis up. Superficial inguinal ring is plugged by spermatic cord. Shutter mechanism is related to internal oblique. Slit valve mechanism is related to external oblique. Ball valve mechanism is related to cremaster muscle. Guarding of inguinal rings. Inguinal ring, superficial inguinal ring, deep inguinal ring. Flap valve mechanism. Anterior and posterior walls of the canal are approximated like a flap. Let us now revise inguinal canal. It is oblique musculo-aponeurotic tunnel. It is 4 centimeters long. It extends from deep inguinal ring to superficial inguinal ring. Inguinal rings. There are two inguinal rings: deep inguinal ring, superficial inguinal ring. Deep inguinal ring, it is oval. It is present in fascia transversalis. It is present 1.25 centimeters above the mid-inguinal point. Superficial inguinal ring, it is triangular gap in external oblique aponeurosis. Base of superficial inguinal ring is formed by pubic crest. The sides of superficial inguinal ring are called crura. These crura meet laterally to form an apex. At and beyond the apex of the triangle, two crura are united by intercrural fibers. It is 1.25 centimeters long and 1.2 centimeters broad at the base. It lies just above lateral to pubic crest. Boundaries. Anterior wall, it is formed by skin, superficial fascia, external oblique aponeurosis in its whole extent. In its lateral one-third, it is formed by internal oblique muscle fibers. Posterior wall, in its whole extent, fascia transversalis. In medial two-third, conjoint tendon. In medial most, reflected part of inguinal ligament. Roof, it is formed by lower arched fibers of internal oblique and transversus abdominis. Floor is formed by grooved upper surface of inguinal ligament along its whole extent, and in its medial most end, it is formed by abdominal surface of lacunar ligament. Contents: it consists of spermatic cord and ilioinguinal nerve in case of males. In females, round ligament of uterus and ilioinguinal nerve. Spermatic cord. Coverings of spermatic cord from outside to inside: external spermatic fascia, cremastric fascia, internal spermatic fascia. External spermatic fascia is derived from external oblique aponeurosis. Cremastric fascia is derived from internal oblique muscle fibers. Internal spermatic fascia is derived from fascia transversalis. Contents: it consists of ductus deferens, arteries, nerves, veins, lymphatics. Arteries: three arteries: testicular artery, Cremasteric artery, artery to ductus deferens. Nerves, 3 nerves. Genital branch of genitofemoral nerve. Sympathetic fibers, cremasteric nerve. Veins, pampiniform plexus of veins. Lymphatics, and it also consists of remains of processus vaginalis. Mechanisms of inguinal canal. Flap wall mechanism. Main factor is obliquity of inguinal canal. Anterior and posterior walls of inguinal canal are approximated like a flap. Guarding of inguinal rings. Superficial inguinal ring. It is guarded posteriorly by conjoined tendon and reflected part of inguinal ligament. Deep inguinal ring. It is guarded anteriorly by internal oblique fibers. Shutter mechanism. Factor responsible is triple relation of internal oblique. When internal oblique contracts, it pulls the roof towards the floor. Slit wall mechanism. It is related to external oblique muscle. Contraction of external oblique approximates 2 crura of superficial inguinal ring. Ball wall mechanism. It is related to cremaster muscle. Contraction of cremaster muscle pulls up the testis. Superficial inguinal ring is plugged by spermatic cord.